Hello, everyone. I'm Mnar Adley. I'm the founder and director of MintPress News. And today I have the pleasure with sitting with a very brave ICU nurse who has just returned from Gaza. I am joined today by Willy Massay. Willy, thank you so much for sitting down with me today.
Thank you. Thanks for having me.
Of course, it's an honor and pleasure. I've been speaking with you since yesterday to hear some of the really horrific and unbelievable things that you have seen in Gaza. And I really appreciate you sharing those stories with me. And in light of that, I'm hoping that we can, share what you have experienced, despite how difficult it was for you to be practicing as an ICU nurse in the heart of this televised genocide. Because so much of us in the West, despite myself working in journalism, reporting on these things, it's still unbelievable just how bad things are in Gaza. But you had a first-hand account working directly in several hospitals, in Al-Aqsa Hospital, in Deir al-Balah, in the Indonesia Hospital in Jabaliyah in the north of Gaza, and you've worked also at the Nasser Hospital in the south. So why don't you just tell me, what was a day in the life of an ICU nurse? What did it look like for you?
A day in the life of an ICU trauma emergency room nurse in Gaza is nothing that I've ever seen in my life, because you really do not have shifts. You're working 24/7. Since you're sleeping in the same hospital, the same rooms, your room is just next to the emergency room. So 24/7, you hear cries, bombs, you hear children crying, women, mothers crying. So literally, you don't stop working. You're 24/7 in the emergency room or ICU, for me at least, because every time there's an Israeli airstrike, I am in the emergency room. Every time there was a little calm in the emergency room, I will go into the ICU and work there. So your day never stops. Never stops. You keep working. After strike, Israel strikes, you work. Israel comes down for an hour or two, you go into the ICU. So that's the life of an ER nurse or ICU critical care nurse in Gaza.
And what were the kinds of things that you saw on a daily basis in the emergency room, in these hospitals?
A lot of gunshot wounds, a lot of straight shots to the head, to the chest, or to the groin, especially for boys. Most of the ones that I've seen in my last trip was quadcopter shots of Israelis shooting Palestinian boys in the groin. And that usually means that their reproductive organs are completely dismantled and destroyed. So these boys in 20 years may never have children. Ethnic cleansing at its worst. I also saw a lot of gunshot wounds, sniper shots in the head, straight, and in the chest, usually the heart. And you can see these shots are usually killer shots. It's not your mediocre amateur shooter. These are killers that are well trained. And when they aim for the heart, usually it's an awful, awful shot straight to the heart or straight to the forehead. Not once, not twice. This is what I always said, is that no one shoots a child once by accident, not twice by accident. These are horrific shots that happen on a daily basis by Israeli snipers and quadcopter snipers. So
They're precise shots.
precise shot, killer shots. You can tell that this person meant exactly what they have done, to kill this person, this child, this mother, right away. We also seen a lot of explosive injuries. After every Israeli strike, A lot of children come in with burn injuries, third, fourth degree injuries, completely shredded. Um, I've seen a mother come to me in the middle of the emergency room when everybody's busy, and she had a little plastic bag. She says, "Here, Alhamdulillah, what can you do?"
And what's inside the plastic bag?
It was a head of a child. I don't know where the part of the body is. Seemed to be like a girl. The way her face looked like, the face we cannot really tell because it was bloody and half of her face was open, was completely missing. The half of the face was missing, and the skin was gone.
And it's just a head.
Just the head, and I saw a couple of fingers underneath, but I don't know what the rest of the parts are. And I just told her there's a brother to go talk to, and he would show her where the morgue is. Um, and I looked at her, Mama, Auntie, what can I do for you? She said nothing. She said, Alhamdulillah, pray for us. I will never forget that mother.
Yeah.
The pain in her eyes, the pain in her voice, is something that will pierce your heart and your soul, and will never leave you. Will never leave you until the day you die.
Yeah.
Until you meet your maker, that's when you get the answers. What was it that mother did to bring me just ahead of her child? And she knew that there's nothing we could do. There's nothing I can do. But maybe just the hope that somebody who understands, somebody who is there trained to help, that give her hope. I don't know what it is. But I pray to God that wherever she is, I hope she's safe. I hope she finds joy. I would love to meet her someday, but I don't know if I will. I'm not sure if she's alive. She was injured. She was bleeding from her forehead, but she didn't care. I was telling her, can you go to, we'll get you seen and go to the, get some images for your head. We'll see what's going on. I hope she's alive. Sorry.
I mean, these are the kinds of stories that we hear on social media, where the Palestinian parents, the mothers, the fathers, they're literally collecting the body parts of their children, their shredded children, from an Israeli airstrike inside plastic bags. And they would bring those bags of their children's body parts straight to you. It's one thing for us to see this on social media. It's one thing for us to hear these stories, but you saw these with your own eyes. How has that affected you?
I'll never be the same man again. None of us will be the same man, same woman again, because for one, I can still smell the smell of mixture of blood, gunpowder, dust, and burning flesh. I can still smell it. Because once you're in Gaza, that's all you smell. When mothers and fathers bring their children to you, or husbands bring their wives to you, or fathers bringing their daughters to you, all you can smell is that smell of blood and burning flesh and gunpowder as you open them up and to see what you can do. That I can still smell it. I can still hear noises. If somebody opens the door and slams it, I lose myself because I feel like there's an airstrike. Most of the time, I feel I'm dead inside. My heart is shredded. My heart is in pieces for the children of Gaza. I remember my little patient, the first patient, her name was Hadil. She was 2 years old. She comes in and completely shredded in the head, shot by an Israeli sniper. She's gasping for air, trying to take her last breath. And I looked at her, she's looking and she's staring, and I thought, my money, my taxes just killed you. I'm guilty, but here I am trying to save your life. Looking at the eyes of a Palestinian child and knowing that the American people, we are contributing directly in their massacre, directly in their killings. How can we be the same? You will never be the same. Your cameraman will never be the same. None of us will be the same because we are guilty.
Absolutely.
I am guilty. I look at Hadil. I said, Habibi, I'm so sorry. I paid for the bullet of the sniper that killed you. Nothing to explain that. And I come home and people do not understand what's happening. Some people, most people now do.
Yeah.
How can we be so blind and not see what's happening? We'll never be the same people again.
Yeah. I myself have lived under Israeli occupation and apartheid, and the trauma that I witnessed as a young child and as a teenager, from when I was between the ages of 9 to about 13 years old, traumatized me. It was ingrained in my nervous system for a very, very long time. And I suffered from severe PTSD, anxiety, and survivor's guilt. And I'm sure you, having just returned from Gaza, having seen these horrors, coming to a very calm, serene lifestyle here in the United States, it really messes with your mind because of what you just said, because it's our tax money that is funding and paying for the literal slaughter of these children, these women, and these men and these boys. You know, we don't talk enough, obviously, about the boys and the men that have suffered through this genocide. And so I can imagine that your daily life doesn't look the same.
One of the most difficult things when you leave Gaza is, as I'm getting into my convoy, trying to see how that I'll never see these children again. I may never see them again. The difficult thing is this: I'm going home to the safety of my own home. I can go home and eat whatever I want to eat. Meanwhile, the Palestinian people just fed me the last piece of bread. The last piece of bread. And so when I come home at my house, I look that I have water. I can shower. In Gaza, there's no water to drink. I have water to water my garden, my lawn, for hours. People in Gaza don't have that. They don't have drinking water. Children are dying of malnutrition, dehydration, and diarrhea. Why? Because the water is contaminated. Israel has destroyed every fiber of the social structure in Gaza. All infrastructure is destroyed. Water tanks are destroyed. They have bombed hospitals. Nasser Hospital, when I was there, the Nasser Hospital is completely gone. Kamal Adwan, I just saw it. Shifa Hospital, I saw it. I have videos of it. I can show you. I've been to Shifa Hospital before the genocide. There's no more Shifa Hospital.
Yeah.
Nasser Hospital was just bombed a couple of weeks ago. While my friends were in the emergency, were in the operating room. And while here as a healthcare worker, I have everything at my fingertips.
Yeah.
In Gaza, don't have gauze to stop the bleed from the head of a child. Why? Not because it's not available, but because somebody is preventing it from entering it.
Yeah.
We are amputating children with no anesthesia. You don't want to ever see that. Because when you're cutting off a limb of a child with no pain medication, a child cries until they stop. They can no longer cry. There's no more tears. They just black out. Think about that.
Yeah.
I went to Kamal Adwan to the center where they were feeding malnutrition kids. I seen bones and skin and just skin and bones left out of children. They don't even have the ability to cry. The child is just staring at you, eyes popping out. Skin diseases like scabies all over. Kwashiorkor. I was born in Africa. The last time I saw kwashiorkor was maybe 20, 30 years ago in Tanzania, when children have so malnutrition, their bellies are big, beautiful skin, hair falling off, eyes protruding, puffy cheek bones. It's nothing. It's the same thing I see in Gaza every single day. That is horrific.
And speaking of the blockade, this illegal blockade that Israel has enforced on Gaza, blocking humanitarian aid coming in, the United States can obviously just say, lift this blockade, but they won't. They're putting this power into the hands of the Israeli government and military. How has this blockade affected access to just basic medical supplies in these hospitals? Like, what other stories could you share with us about procedures that have had to be done without the proper medical equipment?
So, no antibiotics, no medicine. There's a lot of infections in Gaza. There's a lot of upper respiratory infections because of the quality of air from bombing and dust, and a lot of bombings that have caused a lot of air pollution. No simple things like gauze is nothing like that in Gaza. No anesthesia. I want to talk a little bit about, for example, something as simple as a UTI.
Yeah.
Okay, women don't have female hygiene stuff, right? And then they end up getting an infection, and they come in with horrible signs and symptoms of an infection. And because since there is no antibiotics, they end up dying.
From a UTI.
From a UTI. Something as a UTI. A woman dying of that. Sewage system is all over the streets. And so this is the same water that's contaminated. And women are using it to wash their clothing. And this is the same clothing they're going to use as products for menstruation. So the rate of infection among women is so high to a point where when they come to the emergency room, they're already really, really very sick. They become septic.
And they're in pain.
And in pain.
Yeah.
And when they are in such pain and there's no antibiotics, and most antibiotics in Gaza that is available, widely available right now, is called Rocephin. And there's no any other type that I've seen at least. And the rest cannot be, Rocephin is extremely resistant now. And so losing mothers and young girls to infection because they don't have sanitary pads It's very painful.
Yeah.
Something that shouldn't be happening, but it's
So
happening
basic.
in the world.
It's like the most basic, fundamental right of a woman to have access to
Yes.
these, sanitary products
Yes.
for their monthly cycle.
Yes.
And then we have the Democratic Party saying their number one issue is women's health issues. Democrats portray themselves as the saviors of women who support women's right to abortion, women's right to IVF clinics, women's right to all of the health issues that they claim to support. We heard that from Joe Biden, we heard that from Kamala Harris, and yet women are dying from UTIs because they did not have access to sanitary pads during their menstrual cycle.
You mean I'm not a politician, I'm a healthcare worker, but my answer to that is simple. Maybe they just mean white women?
Exactly.
White suburban women? Yeah? Yes, maybe that's it. But if you're any black or brown woman, whatever you are, you're on your own. If Kamala Harris or Joe Biden or any Democrat, your U.S. senators in Minnesota here, if she's a woman, Amy Klobuchar.
Yeah.
If she's a champion of women, Amy, go to Gaza, please.
Yeah.
Go see it yourself. Kamala Harris, go to Gaza. You care about women? Go to Gaza. Look at the mothers in Gaza that have lost their entire families. They have lost children. Tell them that you care. Please do. I'll go with you. It's all a facade.
Right.
It's all what we can see from the outside.
We hear a lot about the women in Gaza, the mothers in Gaza. I mean, it's so distressing to see the pain that they've been through. I'm a mother, I have 2 boys. Cannot begin to imagine the pain that these women are going through. But we rarely hear about the stories of the men in Gaza and the boys. You mentioned that they're targeting boys' reproductive organs so that they don't reproduce later in life and they struggle with their reproductive organs. You worked with a lot of the doctors there, and a lot of them are men. And it's men that are pulling people from under the rubble. They're the ones who are saving the Palestinian children and the women and the daughters and the sisters and the aunts, all these people from under the rubble, wearing their slippers. Talk to me about the male doctors that you've worked with, the local doctors from Gaza, and just the men of Palestine, the men of Gaza.
The men of Gaza, my brothers, Habibis. These are the heroes, the unsung heroes. I know our sisters in Gaza are heroes. I've worked with a lot of sisters that are doctors and nurses. Amazing. But the brothers are the quiet heroes that go and dig out their family members, their children from the rubble. I know a lot of brothers in the Palestinian Red Crescent. These are the people who go and dig out. These are people who are being murdered by Israel every single day. These doctors, I want to talk a little bit about my brother. His name is Dr. Mohammed Daher in Jabalia. I worked with him in the ICU at Indonesian Hospital in the North Gaza.
He's the Iraqi.
I know, this is a different one.
Okay.
This is a different one.
Okay.
I worked with the Iraqi guy at Al-Aqsa Hospital. But this one is, Dr. Mohammed, he had received 12 eggs from the WHO one day when I was there. And he takes them home. His wife makes shakshuka. Shakshuka. And the next day he comes, he's like, brother, Habibi, come eat. I was like, brother, your children have never eaten protein in the last 10 months. I cannot consciously eat this. He says, no, you're our guest. My wife wants you to eat. I was like, no, but I had to. You cannot say no to a Palestinian.
Yes, that's true.
The generosity is nothing I've ever seen, the kindness and the love. And I ate shakshuka and a couple of pieces of bread that brother brought. These brothers in Gaza are strong, faith-filled. They have this strong fatherhood that no father can be compared around the world. They have this joy, this peace, this protective instinct
Yeah.
that you can never see anywhere. But they're the most tender and loving gentlemen that I've ever met. And one of them you can remember is Khalid Naban. Roh Roh.
Oh yeah, روح الروح.
Roh Roh.
Yeah.
I met him. I asked him to come and meet me at the Al-Aqsa Hospital in Deir Bala. He comes in. I give him a sweater that says, as a gift, that says, wear the Gaza Roh Roh.
Yeah.
And then next day he gets killed.
The next day.
The next day he gets killed by Israel. This is the face of Gaza. These are the men of Gaza. These are the brothers of Gaza. Strong and loving.